unmute it. Okay. All right, good morning. Welcome to the Thurston County Board of County Commissioners. Commissioners check-in for June 10th, 2025. Full board is here. Ty Mincer, Chair, Vice Chair Commissioner Fournier, Commissioner Mejia, Grant, and Klaus, County Manager Leonard Hernandez. We have just our standing item to discuss any external board issues or items, and then one specific commissioner item. So who would like to start? Commissioner Mejia, you had external board reports?
Yeah, I did. So for intercity transit has authorized and has joined King County Sound Transit and several other jurisdictions in a lawsuit challenging the Federal Transit Administration's recent actions. So as a reminder, IT receives funding from FTA to provide and improve transit services for our community. This funding supports fixed route, dial lift services, and upgrade to our facilities and technology. To access this funding, IT signs project-specific grant agreements that commit us to the terms of the FTA's master agreement. So several weeks ago, FTA made significant and unilateral changes to its master agreement. And additionally, we were sent a letter from Secretary Sean Duffy with other directions and conditions. Some of these new provisions conflict with federal, state, and local laws, and that conflict opens the agency up to unacceptable legal and operational risk. And the changes also introduce harsh penalties up to 3 times the amount of grant funding if we are found to be out of compliance. So in response, King County, on behalf of the King County Metro and other several jurisdictions, filed a lawsuit and requested a restraining order, pausing these conditions while the case makes its way through the legal system. And so the judge has approved the restraining order. And so wanted to give an update on that piece. For Thurston Regional Planning Council, we have set the new interim director, which is Allison Ostenberg, and I am on the recruitment committee, so we have set out a plan for recruitment. Another big thing that you have probably received comments is on the regional transportation plan. One of the items was that I know Commissioner Menser, you received comments about was the removal of the log cabin road. This topic came up in 2023 as an amendment to the RTP. The City of Olympia was trying to remove the connection from the plan, and removing the project from the RTP could have some significant impacts to the county. So past TRPC transportation models have indicated that not building this west-east connection would adversely impact Yelm Highway in future years. The county's Yelm Highway project, completed in 2012, was based upon a study assuming the log cabin road connection would be constructed. And so my comments were of the, after consultation with Public Works staff, that while the log cabin road project could be removed from the RTP, that the studies must remain on there. And so that was the recommendation from the Transportation Regional Council, that the project be removed, but the studies must be completed. And that would really would assess the impacts to determine whether the connection is still necessary or not. So then the next, that recommendation is moving to the Transportation Policy Board, where they will review it. And then for the Affordable Housing Advisory Board, which is from the governor's office, I had my first meeting and we got updates from Senator Cantwell's office as well as a legislative update. And I have volunteered to be on their legislative committee as well. So I'll be helping out with that. And those are the main items for external committees.
So I have a question on the TRPC one.
Yes, sir.
So it said project removed, but studies go forward, or studies remain attached. Are these studies that are done or studies that are still ongoing?
The studies have not been, they haven't started yet. The last time they were done were back in the early 2000s, and that's basically what how Yelm Highway, we did Yelm Highway based on the study. Lacey did their, I think it was their Martin Way corridor, not Martin Way, but they did improvements as well. And then this was kind of the last piece that the city of Olympia had to do. But the city of Olympia, you know, they haven't really, it's been kind of a low priority on their list. And now, as they have climate goals and their priorities have changed, they wanted to remove this road from that. And so they have to complete and update these two studies that they previously did. And so basically those are the ones that have stayed on the regional transportation plan, but the log cabin as a project has been removed. So.
All right. Interesting. I mean, it's interesting. I didn't know that it was, you know, had that component of the.
Yeah, it was connected, and so what we did is we separated and removed.
Other questions for Commissioner Mejia or parts? Commissioner Grant, you want to go next?
I did not have a whole heck of a lot going on in the last couple of weeks. As far as boards went, I did attend my first, oh boy, let me think of what it's called here. Climate, sea rise. It was my first sea level rise meeting, and we went over bylaws and talked about strategic planning, and that was about it. Just to kind of, we have Transportation Policy Board is tomorrow, and so I'll be echoing what Commissioner Mejia just talked about. Other than that, as far as boards and commissions, I do not have any more to update.
Okay, Commissioner Klaus?
I don't have any updates. There was a JazzCom meeting last night, but I don't have anything from that meeting to bring to the board, so nothing for me.
Nothing.
Nope.
Nothing hot at JazzCom?
No, not this time.
Okay.
It was a long meeting, but nothing too
Okay.
crazy. Yeah.
Commissioner Fournier?
No.
No. I don't think I really do either, looking at my.
It's a light week.
Yeah, I don't see anything that really needs a report. It was interesting, this, well, I will say, Commissioner Grant and I this morning were at Innovative
right.
Justice, and I would say that what was interesting was county manager, I think, and Commissioner Mejia, probably, maybe Commissioner Fournier and Klaus, I can't remember, like that whole thing where there were the HCA program, and there was like phase one and phase two. Reentry dollars, and we were trying to get into it, but we had to, you know, we couldn't comply, and then, well, anyway, Squally Jail, because of, which is kind of cracks me up a little bit. I don't know what your history is, Commissioner Grant, but like Squally Jail has had issues in the past, which is, you know, I'm not saying anything that's not like a public record, like jurisdictions were trying to and did move their people out of there because of past issues. But because I think they're a tribal jail and they have end runs around certain things that we don't, and they have a slightly smaller and more transient population, meaning people stay there like shorter times, and there are a variety of factors, but they were able to get into this program. So now they've got this money flowing and this staffing to where they can basically not release anyone without a warm handoff directly to a service provider, and they have coordinators, and I mean, it's pretty good, it's pretty cool. It's just kind of funny that like we were working on that way before them, and they've kind of leapfrogged because they were able to, because that program started and they were able to get in compliance with the phases of it where we had challenges. So our jail director was at this meeting as well, so she was our newest, our new director, and she was hearing it. And so anyway, people were like, well, why aren't one of the citizen participants was like, well, why aren't the county doing this? Don't the commissioners care about this? And I was like, we care about this. We were talking about it right from the get-go, but we had some obstacles. So I don't know kind of where that stands. I'll just maybe.
And they did say, I mean, it was kind of brought up in that meeting that was kind of said by the jail, you know, that maybe the commissioners didn't want it or something, and so I appreciated that you came back online and said that the commissioners, that you guys did want it, it just, there were a lot of hurdles for the jail to get
Yeah, we
through.
were like, let's go with cohort one.
It was kind of, it was kind of,
It was, what was said was, it was presented to the commissioners and then as if, you know, like, as if, I mean, it was ambiguous. That's why I jumped in to remove the ambiguity.
Yeah.
And just basically say, we were all for it, you know,
Yeah.
we just,
we
you know,
straightened
obviously,
it out.
we don't know the ins and outs of how it gets implemented by the jail, and when they came back with the challenges, and, you know, we never found that solution, at least not yet, but anyway.
Yep.
Nisqually Jail, we do have folks from Thurston County, and what the Nisqually Jail director guy was very quick to point out, which was nice, was that, you know, Thurston County is like, we all have folks that go there, and we're all helping make that work, and because they've been able to meet the state's requirements. I mean,
And they
so.
were able to add they have almost 4 FTE that are dedicated solely
Yeah.
to working with staff.
And you guys remember the big
Yeah.
thing was like, and I know Commissioner Mejia and I talked about this, but one of the big things was like, they've got to send them out with 30 days of like their
Right.
assigned medication. And for certain psychotropic medications, they don't have a way to store that and everything. And they'd have to like contract with a whatever. And so
They brought in a new contractor, they said, medical.
what I thought was funny is that, yeah, they switch contractors, but they also said if we can't store those drugs, then we basically just do e-script and like have it waiting for them at some external thing. I mean, they had a solution that we were never like, wasn't something that we were ever talked about. So I don't know if we, you know, want to see if they've come up with something innovative or that just doesn't apply to us because we're not a tribe or what. But anyway,
By
it was.
the time the meeting was over, we emailed HCA to see if there was any wiggle room for us to get in on cohort 3. So
Yeah.
there's still the ability for us to possibly. I said by the time this meeting was over today, we had emailed, Joe Avalos had emailed to see if there was still any possibility for us to get in on the final 3rd cohort. Which we were supposed to have an intent in by May 1st, but there, you know, there's still a possibility that we could get in on the tail end of that and grow our program out, so. yeah.
Well,
to be
we
clear-
were the ones who pushed for that
Yeah.
program, because when it first came up, WASC was very involved, and it was a lot of conversations for it, and like, they used us as an example, like I was up there really pushing for this, and it was, but once, like, we found out about, like, just the hurdles, it was very disappointing, I remember, for the board at the time, because we'd done so much legwork to be included on it. So thank you for clarifying that, Commissioner Menzer, because you are right, like, we were really ahead, and we kind of got tripped up right at the finish line for it.
Yeah, this was something we worked on, and the then Assistant County Manager Rob Gelder was working.
Yeah, that's right.
To work it through, and I think maybe there's an opportunity there's new leadership over the jail to have those conversations, but there were identified barriers that the corrections team at that time said that they could not overcome.
Yeah.
So,
Because initially the sheriff was fully supportive.
yes.
And we started the process of trying to get our like application filled. I remember we were talking about who's gonna fill out the application
Yep.
and prosecutor, the county manager, or, you know,
Right.
and we were talking all that through and then they came back and said, well, now we found out that there's
I
some
think
wrinkles
Lieutenant
and it could
Becker
not,
is,
might, you know, would not.
yeah,
I don't-
she's interested,
I'm sure, but yeah, we have new leadership, so
yeah.
worth the,
I'll jump in and have that conversation.
okay.
Oh, Chair, I actually do have one update I forgot about. I subbed in for Commissioner Grant on the opioid abatement council
Oh,
last
yeah.
week.
Thank
Yeah,
you.
and there were some definite cuts at the state level I wanted to share. The Law Enforcement Assisted Diversion Program, or LEAD, is getting a 10% cut. Recovery Navigator Program, 20% cut. Naloxone distribution, I don't have, hold on, oh wait, okay, thank you. For the naloxone distribution program, I didn't have like a percentage that was shared, but there's a significant cut that the Department of Health received from the federal government to buy naloxone. So baseline distribution of naloxone will be disrupted down to the nonprofit level. Law enforcement naloxone is still covered, so law enforcement can carry naloxone on them. That's not going to be disrupted at this time. This also means that there will be new programs seeking opioid settlement money due to capacity issues. So I just wanted to kind of flag that for the board. One thing that I wrote down that I thought it just kind of stuck with me was when, someone said that it's time to shift our mindset as local leaders and start looking at state and local funds, because we know federal funding is unpredictable and we need to be planning around that. So I thought that was really important to just consider as we continue seeing these cuts at the federal level disrupting our local services. So yeah, that's what I had to share from that meeting.
Thank you for covering.
Yeah, absolutely. One thing I thought was cool is that Lenny from Lacey talked about the Leave Behind Naloxone program, and it's off the ground, and I think every participating jurisdiction has it up and running now.
Suboxone, not naloxone.
Leave Behind Naloxone?
Yeah, it's Leave Behind
Oh,
Suboxone.
okay. Lenny called it Leave Behind Naloxone program. But if it's Leave Behind Suboxone program, that's good too. Are you sure that that's what it is?
Yep,
Okay.
that just rolled out like 3 weeks ago.
Okay.
Because you could, the Narcan's not a new thing.
Yeah.
They've been able to distribute that, but now we're one of 3 counties that are actually able to administer Suboxone in the field, and I think we're the only one that has a Leave Behind Suboxone program in the field. And they've teamed up with Catholic Community Services to have like the handoff program to where they can actually have some aftercare guidance and help after they get administered the Suboxone. Ben's come and talked to us about, Ben Miller Todd, a few times, and it's a pretty remarkable program. So, and they just launched that like 3 weeks ago.
Okay. Yeah, that's awesome. That's not what I thought was shared, but that's good too.
It's people confuse. I mean, I'm sure you're well aware. People just
They
confuse
can
the
sound
two
the
different
same.
things.
Naloxone, Suboxone. Yeah, that makes sense. Well, the program is up and running. I know Commissioner Fournier has been part of those conversations, so I thought that was really exciting. Now that I know it's Leave Behind Suboxone, I'm kind of wondering how that works, because you said that there's kind of aftercare and stuff.
Last year's discussion was about BLS Narcan not
Yeah.
being a part of our program. That was rolled out earlier this year too. So the more of our first responders are able to administer the naloxone, AKA Narcan. But 3 weeks ago, they started the program where Ben's come in and he's talked about kind of this grand vision for, not just, patching the wound with Narcan, actually trying to provide interventions and, having, full kind of wraparound services when somebody is, found to have had an opioid overdose. And there's a lot of nuances to it, and it's gonna be, it's gonna be a lot of work, but it's pretty impressive, the kind of the flow chart that he's put out there for people for care.
Yeah. So do you know if that program, like, they leave behind Suboxone, but do they also educate them on, I mean, because Suboxone, if you're going from an overdose to taking Suboxone, you'll just go immediately into precipitated withdrawal. So I'm wondering if there are providers that help with that process, because if someone's like living outside and they take that and they're like thrown into this precipitated withdrawal, which makes you extremely sick, and there's no care, that's not gonna be helpful. So I'm just kind of wondering how that works.
Exact details that, that'd be something to talk to Ben Miller Todd, but it is not it's not a here's the drugs buy kind of program.
Yeah.
And they have to have, and of course it's coming from 911. So the system is not designed to have, the paramedics act as like social workers too far into the weeds. But what they are doing is remarkable, and it is a new total skill set for them. There's a 30-minute requirement once you administer the Suboxone to stay there with them, and then they do provide some aftercare, which is also a very new concept. But then there is a handoff to a contracted agency between EMS and I believe it's Catholic Community Services, where they will have somebody do follow-up care with them to ensure that they get the kind of ongoing treatment and ongoing needs.
Okay,
I do want to just jump in, just to clarify, it is, just to make sure I looked it up, it is the EMS overdose responses, EMS naloxone leave behind program.
that's what I
Yeah.
thought.
Just
It doesn't
'cause
make
Suboxone
sense
wouldn't-
really.
I just want to make sure for anybody listening that we wouldn't want to leave behind Suboxone,
Yeah, that would be,
which would be which is a narcotic, so, anyway,
No, that's,
yeah.
that is what's happening. That was just rolled out like 2-3 weeks ago.
Oh, okay.
And we've had multiple presentations on it.
I don't think that's right.
What I'll do, commissioners, is ask Ben Miller-Todd to provide a quick update for all of you.
Yeah.
And then from there, we can have more discussion if needed, just to clarify.
Yeah, because Katie Strozik was the one running that meeting, and I'm sure if Councilmember Greenstein was not right about what he said, it would have been corrected in the meeting.
Yeah.
And so it was definitely naloxone that was mentioned in the meeting.
Okay. Well, then it's likely just two concurrent things that are happening
Okay,
at the same time.
What's called leave behind?
naloxone or Suboxone, they both sound kind of the same.
NALA-AXON. Okay.
Okay, does that cover external boards?
We're meeting with Ben at 1:00. He'll be here in the office, and I could ask for him to send an e-brief out.
That'd be great. Yeah, it may be two concurrent programs that make sense.
Okay, then next up, we have the commissioner item request, joint planning session with Olympia Council.
Yeah, commissioners, and for clarity, this is a request from Commissioner Klaus to have a planning session with City of Olympia regarding the court services, not just a general touch base with City of Olympia, but specifically regarding court services. And I'll turn over to you, Commissioner Klaus.
Awesome, thank you. So as the board knows, you know, our county is taking over Olympia's municipal court services. I've had a lot of conversations about this, and I'm really looking forward to seeing the ILA come forward. I know that Olympia has a planning session about this on Thursday at 6 p.m. So more information will be shared at that time. Initially, my request, as you may have seen in the email, I can't remember how much detail was shared in the email that was forwarded, but initially I was going to ask for a joint meeting prior to the ILA being finalized. But after having several conversations with council members, I realized that's not feasible because of the timeline and the requirement to give that Olympia has to give 6 months notice to make that change. And with summer recess, it just didn't make sense to try to get like 13 people in a room to talk about this within the next couple months. So at this time, I'm changing my request. Rather than asking for a joint planning session prior to the ILA, I would like to have a joint planning session with the council just at some point this year to talk about this shift. And I also had, you know, if anyone wants me to go into the details of what I hope to discuss, I'd be happy to do that. But is there any feedback or are there any thoughts at this time about the request? Would the board be supportive of direction to plan a meeting like this?
I don't necessarily see the need for a meeting on this unless Olympia wants it. But now that you've said it in that way, what I would like to see is we've had periodic meetings with the Lacey City Council, and I don't know that we've ever had one with the Olympia City Council. We could do something like that that's general, and that could just be an issue. Like, that could be one agenda item is like, hey, how's this going, or what issues are there, or what, you know, that could be like something that's handled in a more just like touching base way.
That'd be perfect.
An in-depth work session on just the court merger, I don't, you know, at that point is, I think it's gonna be unneeded and probably too late.
Should be moot at that. I wouldn't want to interfere with the court's negotiations and the, you know, and the Olympia, you know, because I don't know that we should be at the table negotiating things with them. That's, I don't know if that's our place, but as Commissioner Mensah just, put it, there's lots of things that we could talk to them about, and if that's the intent, then that's something we should try to do occasionally with all jurisdictions.
Yeah, I agree.
We do it at some level with the mayors and the chair.
Right, right.
And that happens monthly, and those are great meetings, but beyond that, I think that the intent of the fifth Wednesday meetings is to kind of do that in a very informal way, but it's everybody.
Commissioner Mejia, anything?
I would be in support of a more general meeting as well.
And including that as a topic, just amongst others.
Yeah.
That
Okay.
sounds great, yeah. That was actually something I was kind of leaning towards as well after a conversation I had with Councilmember Madrone. And she said almost the same thing, like there are multiple issues that we connect with Olympia on, and it would just be good to have a broader meeting probably about whatever topics we want to bring up. So I would love that. I think that'd be great.
Manager,
Yeah, we can,
direction to just maybe in the late summer or something.
Yep.
See if Olympia would like to, that would be, I think, useful. It helps build relationships and,
Yeah, what does the timeline look for the court
yeah, what,
discussion? Because I would want to, I wouldn't want to put one before the other. I want to be careful of not, holding anything up or, not putting the impression on that we need, what's the timeline look like for the
the
court
ILA
discussion?
should go to their council in probably mid-July and then come before us late July. So if we plan something for
we couldn't get
late
it
summer,
scheduled
early
before
fall, it'll take that long to get on calendars anyways.
Okay. Sounds good on that. Any other commissioner items this morning? Commissioner Mejia, is that a hand? Okay, then I think we're adjourned.
Awesome, thank you.